The Foundation for a Healthy Kentucky testified this morning on the benefits and concerns surrounding a waiver proposed by the Bevin administration, which has the potential to transform Kentucky's Medicaid system.
Andrea Walker was in Frankfort today to bring you the latest.
Thank you, Mr. Chairman.
The Foundation for a Healthy Kentucky is an organization whose goal is to address the unmet needs of Kentuckians by informing and influencing health policy in the state, which is why today's hearing was so important to Dr. Susan Zepeda and her team.
Consideration of the Medicaid waiver today is something that we care very deeply about. And we approached it in the way we usually approach things, which is, what does the research tell us? What are other states' experience with waiver applications like this to inform the deliberations of our legislators today?
The federal government permits states to experiment with doing Medicaid differently through waivers, like the 1115 waiver discussed today.
And what it does is it has to show that the state's doing something innovative that either expands access to care or does care differently, bringing something new to the Medicaid work of the nation.
Zepeda praised several aspects of the proposal, including the expansion of substance abuse treatment and healthy behavior incentives, but she also addressed a few concerns.
Part of our conversation today was about what we don't know about the people who are on Medicaid. It seemed almost as if some folks were equating being on Medicaid with being unemployed. And we're aware that a good many, some have said more than half of the newly insured are actually employed.
While the issues discussed today were at times confusing, the ultimate goal was quite simple.
Let's make sure we're designing a waiver that meets the real needs of real Kentuckians.
In Frankfort, Andrea Walker, WKYT.
The administration will now revise their proposal to submit to the Centers for Medicaid and Medicare Services. The proposal will then be reviewed and revised on the federal level.